And it looks like Democrats may not meet President Obama's latest deadline to finish work on the health care bill.
The president wants the bill done by March 18th. House Speaker Nancy Pelosi now says she won't call the bill until she has the votes, and she says right now she does not. Live from Washington, D.C. with reaction is Republican Illinois Congressman Don Manzullo. Good morning. Thanks for joining us, Congressman. So White House Chief of Staff Rahm Emanuel came out of a meeting last night saying, quote, "We made a lot of decisions. We're getting toward the end. The end is near. The outcome is still uncertain." From what you are hearing there in Washington, D.C., what are your colleagues saying? Do they have the votes, and how much short of votes are they if they do not have them?
Well, at this point, the Democrats did not have the bill because they have to pass the exact Senate bill. And that's the bill that has taxes on medical devices, raises taxes by $500 billion. There's a $500 billion cut in Medicare. It has all the special interests in there for Nebraska and Louisiana and Florida. Plus, it doesn't have the protections in there against spending money for abortion, federal money for abortion. So they're going to have to convince the members of the House on the Democratic side that the Senate bill is palatable to them. They're going to pass that first, then pass another bill under reconciliation, and then possibly a third bill that may deal with the abortion issue. That's how complicated it is.
And I know that a lot of Republicans are saying, well, maybe the House shouldn't trust the Senate to actually do the House's work.
Well, members of the House never trust the members of the Senate. That's institutional, also constitutional. The problem is we've got to look for the common areas so we can bring about meaningful health care reform. I mean, for example, there's a bill out there called the SHOP Act that was drawn up by the National Federation of Independent Businesses and the SEIU and other labor unions. Dick Durbin's a sponsor of it in the Senate. I'm a sponsor of it in the House. That essentially would allow association health plans to allow small business people and small groups to band together to form giant purchasing pools. I mean, we can pass that lickety-split. That'll go a long way towards it. But you know, we hear all the time of people that are paying tremendous health insurance premiums. A lady called the office yesterday. $34,000 a year she's paying on a very small group plan. Another fellow called $24,000 a year. So something has to be done to bring down the harsh costs of these of the medical bills, which in turn drives the cost of health insurance. And you do that by the association health plans that allows little guys to come together to form large purchasing pools and also meaningful tort reform.
Right, I got to ask you something, Congressman. Of course, everyone's talking about tort reform and such, and I keep hearing about everybody saying, okay, we got to bring these premiums down. I haven't heard one lawmaker say, how's my doctor bill going to go down? How's my hospital bill going to go down? What about that?
Well, the point, what tort reform will do, first of all, it brings down, as in Wisconsin, the high cost of the health of the medical liability premiums for hospitals and doctors, and second of all, it can eliminate as much as $25 billion a year in defensive medicine, because all kinds of tests that are given that are not needed simply because of fear of lawsuits. And so, I mean, there has to be a plan to bring down the curve, to stop the curve of increasing for healthcare costs. I have to ask by the way, Marquette won last night.
Thanks for pointing that out.
We'll mention that in our sports next hour. I know you went to school there.
I have to ask you one question though.
Yes, that's correct.
Off the healthcare topic, former Congressman Eric Massa, he's been making a lot of news, you know, tickle fights, etc. Now I know there's a big push in Congress to investigate who knew what when, and perhaps, you know, if Democrats have done something sooner to push him out. What's your thought on that whole issue?
Well, actually, yesterday there was a vote. Everybody except one in the House, all the Democrats and all the Republicans voted to continue the investigation and sent it back to the Ethics Committee to continue doing interviews and find out more about the topic. So we ended up really with a bipartisan vote to find out if there was anything deeper than what we've seen on the press.
How well do you know Congressman Massa?
I've only met him once.
Okay. So, sums that up, I guess. Yeah, all right. Thanks so much for joining us.
No tickle fights.
Thank you.
Maybe a handshake.
Don Manzullo. No, what's that?
No, Marquette plays Georgetown today, so that's important.
We will keep an eye on that for you. Thank you, Congressman Manzullo. We appreciate it.